My name is Francisco Lopez Jimenez. I'm a clinical cardiologist and director of preventive cardiology at Mayo. And this is about the paper titled A Summary and Critical Assessment of the 2013 American College of Cardiology, American Heart Association Guideline on the treatment of blood cholesterol to reduce atherosclerotic cardiovascular disease risk in adults. Filling the gaps. In November of 2013, the American College of Cardiology and the American Heart Association released the set of the newest guidelines to manage cholesterol. That release came along with other guidelines, including the one for cardiovascular risk assessment, the obesity guidelines, and the one about cardiovascular risk reduction. During this time, a group of clinicians from Mayo Clinic discussed these guidelines and came up with the conclusion that even though they were an excellent step to lead cardiologists into a better practice, we found that there were several points that were not entirely covered and some gaps of information. The guidelines came under a lot of scrutiny and criticism because there were some points there that were considered highly controversial. So we decided that it was also important to address those controversies from the clinical perspective. We put together what we call a task force to address the American Heart Association cholesterol guidelines and included experts in the field of preventive cardiology, cholesterol management, cardiovascular risk assessment and risk reduction, as well as endocrinologists, general practitioners, and preventive medicine experts. We addressed the very same questions that the American Heart Association, American College of Cardiology Committee decided as the clinically relevant questions. And those were basically to determine if the standard approach to target specific goals of cholesterol were appropriate. We soon realized that after the release of the cholesterol guidelines, there were numerous publications criticizing the guidelines without actually proposing something different. At the same time, there were other publications that were basically endorsing the guidelines without necessarily addressing some of the limitations or gaps of information. In this paper, we give a succinct summary of what the guidelines are all about. And along with those recommendations, we put the difference or where we stand in a slightly or entirely different way. We highlight the importance of having the patient involved in the decision-making process. We propose the use of some specific tools that have been used at Mayo Clinic for a number of years, where the patients can actually learn the potential benefit and side effects by using statins. We have learned over time that not everybody will accept the cholesterol treatment at the same level of risk. In the process, we try not to replicate just the information provided by the American Heart Association in the cholesterol guidelines, but we rather focus on things that might help clinicians with very specific recommendations. For example, it has been shown that the use of very low doses of some potent statins like rosuvastatin, doses as low as 5 milligrams every other day, can indeed achieve significant cholesterol reduction up to 25%, which might have some protective effect in those patients, considering that the option is not taking any other cholesterol medicine. We also give specific recommendations and list specific medications that can be considered. However, we recognize that some medications have actually never been tested. I think it's fair to assume, or at least to consider, that patients with significant statin intolerance might benefit using alternative medications other than statins. But we recognize that that approach is 100% empirical. Yet we understand that guidelines have the main goal of standardizing medical care. by providing simple and valid recommendations that will apply perhaps to the majority of the patients with that particular condition. But we also recognize that guidelines don't necessarily focus on individualized aspects of care. In this paper, we try to address situations where the guidelines basically don't provide a specific recommendation. So we hope that you find this paper valuable for your clinical practice.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.